Hi, Steve Adubato. Welcome to a very important discussion on the current state of healthcare and the future of healthcare. We're joined by Jeff Alter, the CEO of Summit Health. Jeff, good to have you with us.
Thanks, Steve. Glad to have some time with you today.
Absolutely. Jeff, let me ask you, you come with an interesting background to Summit Health. First of all, explain what Summit Health is to everyone, and then we'll talk a little bit about your background.
Sure. Summit Health is a connected care model that goes across this tri-state region with the connection to a very large urgent care practice called CityMD.
Right. And your background?
Yeah, so I come at this having spent the past 25 years of my career in the health insurer side, mainly with United Healthcare and most recently with Anthem. And quite frankly, gotten to see what works and doesn't work in terms of medical groups across the country. And Summit Health is one of the groups that works. And having spent the past 4 years on the board, I've always been really excited about the promise of linking a first-class urgent care network with a top medical group to create a high-quality care delivery model with hundreds of access points.
Let me do this. I want to disclose that Summit Health is one of the underwriters from the healthcare side that supports our healthcare programming. And the other thing is that in my hometown of Montclair, Summit Health just opened up a Summit Health facility. And what struck me about it when I was there was that everything, I should say everything, I went to see an orthopedic specialist there, but you look around and there are lots of other specialties in this building. Is that thinking and is that model, Jeff, intended to deal with what you have called the siloing, if you will, of healthcare?
Yes, we believe that one of the issues that confronts or challenges that confronts us in the way that we deliver care in the U.S. system is fragmentation of care and the ability to have under one roof many multi-specialty practices along with your primary care physician enables you to get that connected care, knowing that you're not going to fall between the gaps of the various silos of healthcare.
Why is it taking so long to figure that out? Because on the surface, it seems logical, but easier said than done.
I think there's a lot of dynamics in play. And quite frankly, just the way that the healthcare system is really a bunch of smaller physician practices and then very, very large hospital systems, but not a lot in between. And that's I think, the promise of Summit Health is to create that in-between model.
It's interesting. By the way, what I mentioned, it's actually a medical hub. It's a healthcare hub, if you will, coming together that I mentioned before. You've also told our producers, and you've talked about this, about the aging population. What does an aging population have to do with the larger healthcare issues we face as a state, region, and nation?
I think there's probably three challenges. One, we've already talked about the fragmentation, the cost of the system, and then we've got an aging and probably a somewhat less healthy population. And so perhaps if, in days gone by when we were younger and more healthy, the fragmentation and the chances of you falling through the cracks of the system mattered less. But as we get older, as our population gets, somewhat less healthy, those important connection points really drive a lot of the cost and, quite frankly, the poor outcomes for folks in the country.
I've talked to a lot of physicians. I've done a lot of leadership coaching and communication coaching with physicians. And the whole question of quality, right? Quality outcomes, patient care. And then you got the finance, the economics of this, right? And there are a fair number of physicians, and you deal with them all the time, Jeff, who say, wait a minute, you want me to have better quality outcomes, but you also want me to have the metrics, the numbers that show that we're being economically efficient and, dare I say, profitable. Do they match up well in your mind and in reality, Jeff?
I do believe they do. The system needs to use data and technology better and differently than it has in the past. And I think that is one of the challenges of a smaller practice, is the ability to invest in those and understand how to use those to create better outcomes, and quite honestly, to prove your value. And so I do believe that there is a lot of value being practiced across the country, but getting your arms around what that's worth and how to do that in a more systematic and data-driven way is one of the challenges, but I think it's also one of the opportunities to really improve healthcare in the U.S.
Final question on this one. Jeff, I'm not the only person who's used FaceTime or Zoom or whatever technology you're talking about for a telehealth visit with a particular physician. And it works in some cases, and in others it's a little tricky, and in some it absolutely does not. What do you see as the place for telehealth moving forward into 2022 and beyond?
I think there's two primary areas where we've shown over the last 18 months or so that telehealth could work really well. One is behavioral health, getting access to those clinicians in an almost immediate way is vitally important to the behavioral health of our patients. Number two, I think the follow-up, getting people back into an office after they've had a procedure or is difficult. And we can eliminate a lot of hospital readmissions if we can connect virtually to those patients, find out how they're dealing with the post-surgery or not, and then intervening before it gets to the point where they have to go back to a hospital.
Yeah, it's complex stuff. And by the way, real quick, before I let you go, you learned a lot during COVID, have you not, you and your colleagues?
We have I would say that it was a great experiment, and we've learned where things work and what can and cannot be continued in the future.
Yeah, no one would have wanted to have learned from this, Jeff, but the reality is either you pivot and you adapt or you don't. And again, once again, to all the healthcare workers on the front lines, we can never say thank you enough to physicians, to nurses, to respiratory therapists, and so many others. Jeff Alter, CEO of Summit Health, I want to thank you so much for joining us.
Thank you, Steve.
You got it. Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by MD Advantage Insurance Company, NJ Best, New Jersey's 529 College Savings Plan, the Turrell Fund, supporting Reimagine Childcare, Johnson & Johnson, Valley Bank, Delta Dental of New Jersey, Suez North America, the New Jersey Board of Public Utilities Clean Energy Program, and by the Adler Aphasia Center. Promotional support provided by Insider NJ and by New Jersey Globe.
What is your child's dream for the future? Doctor? Teacher? Architect? Whatever they aspire to be, a college education may realize those dreams. And NJ Best can help. It's the college savings plan specifically designed for New Jersey families. Start saving today with as little as $25, because now is the time to invest in their future. To learn about NJ Best 529 College Savings Plan, its investment objectives, risks, and costs, read the Investor Handbook available at njbest.com.